what is trauma-focused CBT? So when we experience something overwhelming, when we're frightened or we're deeply distressed, this can leave long-lasting emotional effects. So trauma-focused cognitive behavioral therapy, or TF-CBT, can be a really great approach to start to unpick the impact of trauma and to help us make changes that are empowering. And it's designed to help children, young people and adults recover and cope better with traumatic experiences. So trauma-focused CBT is an evidence-based tool, which is a psychological treatment. And this means that it's been tested in many different contexts and many studies, and it's proven to help those individuals who've experienced trauma. So it blends two approaches: the trauma-focused approach and trauma-focused work, which gently helps us to understand and process what has happened to us, and cognitive behavioral therapy, or CBT, which focuses on our thoughts, our feelings and our behaviours and the interconnection between the three. So we look at how trauma and our thoughts, feelings and behaviours all interlink. So TF-CBT is widely used with children, adolescents and adults, and it's helpful for those who have experienced things like abuse or neglect, violence, accidents, natural disasters, traumatic grief, or any life-threatening event. And that's us perceiving an event to be life-threatening. Or anything that's been completely overwhelming, that it's impacted our sense of safety in the world. It's also designed to support parents and caregivers to really help that individual cope better and to create a safer environment. So it's a really well-rounded approach which has a good solid base to it of evidence. So in trauma-focused CBT, it's a structured, a gentle and a very paced approach. So it's paced according to the person's readiness to engage. So it usually includes building coping skills. So before talking about trauma directly, clients learn how to manage their emotions, to re-regulate, to reduce their anxiety, to relax their bodies, and to understand how their thoughts affect their feelings. It also creates a trauma narrative. So when a person feels prepared, they work with their therapist to safely and gradually tell the story of what's happened to them and how the trauma has impacted on them. So they relive the experience in a safe way, but this is in order to make sense of it and to reduce fear and to regain a sense of control over their lives. It can also help to challenge unhelpful thoughts. So traumatic events often create beliefs like it was my fault, I'm not safe, or I'm to blame, or I'm different from everyone else. So this really helps people to replace some of these negative thoughts with more balanced, compassionate and caring and realistic thoughts. It can also help to strengthen the support that we have around us and to think about how we support ourselves too. So what do you need in order to feel safer in the world, to reduce your triggers and to create a safe environment for yourself, both internally and externally. So people who complete trauma-focused CBT, they often report fewer traumatic memories and nightmares, a reduction in anxiety and depression, feeling more in control over their lives, feeling freer, less overwhelmed, feeling better in terms of their self-esteem, and stronger relationships both with themselves and other people. And most importantly, there's a hope for the future. So by understanding what happens and learning skills to move forward, people regain the sense of safety, confidence, and also resilience. They build that for themselves. So although trauma can have very deep-seated consequences and leave marks on us, it doesn't have to define who we are, and it doesn't have to define our whole life. So with the right support, healing is definitely possible. So do think about that if you have been struggling with life after a traumatic incident, and see if TF-CBT could be useful for you.